Right. Well, I think we can get started as more people trickle in. That's totally fine. So for introductions, my name is Kathryn Fluehr, and I'm a senior program manager at Odyssey. I've been working closely with Shell Foundation on the development and implementation of this pilot program, the Shell Foundation Pilot Program for Innovative Financing and Project Solutions. I've also been working very closely with the 6 grantees participating in the pilot, including the 4 we have here today: Nuru, Powergen, ARESS, and Infra, formerly Stella, Futura. As the final piece of this pilot, we've also had the invaluable help and direction from ECA in pulling together a full analysis and providing recommendations in our final report, which was published and shared back in February. We wanted to organize this webinar today, though, as an extension of that final report, but mainly also as an opportunity to give the floor to participating grantees and let them share a bit more about their experiences in the pilot. ECA will also be summarizing some of their insights and recommendations, and I'm going to kick us off with a short overview of the pilot and Odyssey's role. We'll also be leaving 10 minutes at the end for a Q&A, so please feel free to chat questions as they come up for you in the chat box, and we'll try to get to everything at the end. So I'm sharing my screen right now. I hope everyone can see it, and we'll just dive in. It looks like we have over 50 participants now, so a good number to get started. All right, so at a very high level, this pilot program was developed to address access to reliable health services, especially in the wake of the COVID-19 pandemic. Today, over 40% of health facilities in sub-Saharan Africa lack access to reliable electricity, while 15% are without access entirely. And these stats disproportionately impact rural health facilities and low-income communities. For the pilot, 6 developers participated across 4 countries, commissioning projects at 11 total health facilities, ranging from smaller community clinics to larger regional hospitals. Guiding the pilot, we were focused on a few key elements. And first was the idea of exploring success factors inherent in innovative financing solutions. So we set out to look at what financing schemes and business models might be applied to health electrification in order to make projects less reliant on exclusively donor funding and more sustainable over multi-year time horizons. A challenge historically in the health sector has been ongoing operation and maintenance of systems once they're installed. So we also set out to explore how automated data collection and remote management could aid this, and also play a role in executing the various business models that we set out to test. Here we deployed Odyssey's remote monitoring and control solutions, which I'll share a bit more about in a few slides. Underlying all of this, our North Star has really been to use the relatively small scale pilot to provide learnings for the sector. So to give a high level overview of how the pilot was set up and implemented over the last few years, we kicked things off with a call for proposals, inviting DRE companies across sub-Saharan Africa to submit ideas about projects and how they might go about financing those projects. Grant funding would be rewarded as a way to bridge potential financing gaps, mainly for project CapEx. Shell Foundation and Odyssey, as well as a couple of other third-party partners, completed a full due diligence review of those applications, looking at criteria like potential community impact and a company's track record for executing similar projects. Once companies were selected, we developed agreed upon milestones with each grantee and executed contracts based on those milestones. Once the project kicked off, as mentioned in the last slide, a key element has been providing learnings for the broader sector. And in that vein, data collection was a critical element. We collected both that baseline and endline facility and patient data through surveys. And baseline was collected pre-electrification, while endline was collected at least 3 months after projects were commissioned. Throughout the pilot, we also focused on gathering qualitative learnings about financing, operational, and technical challenges from grantees, which has been extremely valuable, pulling together kind of the final analysis of this pilot. Also mentioned on the last slide, a key component was to identify and demonstrate the role of technology. So we deployed Odyssey's remote monitoring and control solutions for the automated data collection, analysis, and remote control of systems. Lastly, we worked closely with ECA to develop a final report with key learnings and recommendations for the sector. And ECA, specifically Elena, who we have on the webinar today, will be speaking more about this a little bit later on. So before handing it over to the grantees, I wanted to go into a little bit more detail on how we've leveraged technology to support these health electrification efforts, and specifically what we tested in the pilot. So to take a step back, Odyssey is a fintech platform to scale the distributed renewable energy sector. Today, our platform supports nearly 2,500 companies that are using our digital tools to finance, procure equipment for, and operate their projects. We have over $1.5 billion of available financing through various types of RBFs and concessional and commercial funding programs. And to date, over 2.3 million connections have been facilitated through the platform. We have a suite of digital tools that aim to remove friction and collect data at every stage of the project lifecycle for both DRE financiers and then the developers of the projects. Because we're collecting data at every stage, we're also able to provide powerful automated analytics on that data. For this work specifically, our remote monitoring and control technologies were especially important. So Odyssey is compatible with hundreds of OEMs, and we have our own proprietary hardware as well that can be installed at sites to give stakeholders the data and insights they need to manage and control their decentralized assets. So for this pilot specifically, we set out to test how our remote monitoring and control solutions could help solve some of the O&M challenges seen in the health sector. Through this pilot, we were able to refine our monitoring solutions for health specifically, like improving visualizations to showcase KPIs that are most critical to health facilities and improving integrations with components that and equipment that might be most common at health sites. So Deji from Powergen is going to speak a bit more about their experience with the Ijebu Eye Clinic in Nigeria. But I wanted to share a couple of sample dashboards from Odyssey, highlighting the remote monitoring and control piece. Here on the left, we can just see a high-level flow of energy in a layout diagram. And then over on the right, getting a bit more granular, looking at things like time series data of AC loads and solar power generated, as well as events like downtime or errors specific to various components in the system. In addition to providing analytics based on system performance, we also used Odyssey and our analytics platform to analyze broader health and impact KPIs collected through the surveys I mentioned earlier. So as part of our pilot, we were able to improve our methodologies around data processing to ensure standardization of survey data and to ensure we could easily compare metrics across sites. These dashboards on this slide are showing some key results from the pilot around finances and quality of medical care, but ECA will be diving more into the pilot's impact a little bit later on. So with that, I want to hand it over to Deji at Powergen to speak more about their experience with the Ijebu Eye Clinic in Nigeria. So Deji, if you wouldn't mind taking over, I'll share your slides here.
Yeah, thank you very much, Kathryn. Yeah, I think I can see the slide. Would I be able to control the slide from my side? Okay. Yeah, thank you very much. Hi, everyone. My name is Deji Adegbenro, and I represent Powergen. I work as the senior associate for commercial and industrial project for Powergen, and essentially I manage the entire project uh, regarding the Ijebu Eye Clinic, essentially managing the financial side of things and also the technical side of things around C&I projects, and also this specific project, um, um, which is the Ijebu Eye Foundation. Powergen was founded in 2011, and since then we've commissioned over 5 megawatts of solar battery projects, which is a mix of commercial and industrial and microgrid projects. We've got offices in Lagos, Freetown, Nairobi, and also Kinshasa. In total, we've been able to electrify, or rather provide electricity for over 30,000 end users. We've raised financing through Shell, Infra Futura, World Bank, Rockefeller, and Cross Boundary. The next slide, please. Oh, okay. Yep. First of all, a big thank you to the entire team regarding this entire project. The funding was very utilized for the project and aid the entire execution process of the project. But first of all, I'll talk about the project background and site selection. In terms of the background, the ophthalmologist or the chief ophthalmologist of the eye clinic has been a close friend of one of the management team in Powergen. So when we started the commercial and industrial project in Powergen, it was much easier for us to select a particular site, especially commercial and medical sites, that we can then implement a commercial solar project for such an entity. So we went ahead with the ophthalmologist, who's a friend of the management, as I said earlier. His name is Dr. Asante. And before then, we had implemented a commercial project for his residents, and he was able to see some good amounts of energy savings or energy cost savings. And he decided to implement the same type of project, but in a different model for his medical facilities, which is the Eye Foundation Clinic. The initial plan was to proceed with a technical site survey where we went to the site, gather the current operational data in terms of energy demand, and then did some simulation and proposed a solar system of 180 by 182 kilowatt hour. The project has been operational for 1 year and 5 months now. The entire implementation was slightly seamless. There wasn't any major concern around execution. And the business model around the project was a power purchase agreement for 10 years at a tariff of 15 cents with a yearly review of, or with a yearly escalation of 3% per annum. The customer has seen some significant savings in the diesel consumption or in the national grid consumption, and also significant savings in general energy consumption or savings rather. In terms of contractual terms, like I said earlier, the business model for the project was a power purchase agreement for 10 years, and where we also consider tariff escalation annually at 3%. The grant the grant was able to cover 42% of the entire capex needed for the project, while 58% of the rest of the funding came in as debt financing. In general, the grant was able to ease a lot of concerns and issues around the project, and a big thank you to the entire team that managed the entire grant process. I'll go to the next slide. Yep. So like I said earlier, the project has been in operation for, I think, 1 year and 4 months now. 5 months, I can't recall correctly. And since then, we've hardly had a major concern around operation of the project. As a matter of fact, the site has seen, or the facility has seen, a very good amount of energy cost savings, and we are currently executing a technical site survey for one of their branches in Lagos. So the I Foundation is a project in the southern Enugu state, which is one of the states in the in the southwestern part of Nigeria. And we're currently executing a technical site survey with one of the branches in Lagos. So far, so good. There hasn't been any major technical issue or any commercial issue. In terms of billing and revenue collection has been smooth. Also, in terms of technical operation, it has literally been smooth. But I know we did add some financial concern or issue during the execution of the project, and that was because of the fluctuating exchange rates. At the point of execution, the exchange rate, which is the naira to dollar exchange, was about 420 naira to a dollar, and in the middle of the project, the exchange rate went from 420 to 750 naira to a dollar, which impacted the project capex. The contractors came back with pricing review. A couple of the prices of items in the market gone up by 50%, which kind of affected the entire project capex. But eventually, we were able to scale through and execute the project seamlessly. In terms of the impact of the project regarding the health facility, first of all, the health facility has seen 40% energy cost savings over the last 1 year, which has impacted their operation, and they've been able to, develop newer structures within the facility. They've been able to bring in more medical devices because they've been able to save more money on the energy side of things. Also, they've been able to operate into late in the evening, which before they shut down operation by 3 p.m. But with the presence of the solar system, they've been able to extend the operation beyond 3 p.m. Sometimes they work till 8 o'clock, depending on the inflow of patients within the health facility. So generally, the facility had seen a good amount of energy savings, and of course, they've been able to scale up their operation, and of course, been able to acquire more medical devices to scale up their operation generally. Then the next section, we talks about the role of the pilot. Could you go back to the previous slide, please? Yeah, the section that speaks about the role of the pilot in supporting education projects and recommendation for design in the future. So like I said earlier, the grant was able to, support the project capex, whereby we're able to discount the solar tariff. With the grant, we're able to propose a tariff of 15 cents per kilowatt hour, but without the grant, we would have proposed figures around 19 cents per kilowatt hour. And also the grant is actually a very important tool in synchronizing project developers with health facility with several end users. In general, the grant has been impactful in the entire project execution. The next slide, please. Yeah, in terms of operation, the remote monitoring system, which is the Odyssey view, has been very, very helpful in terms of planning preventive maintenance, and also having access to live data from the site. With access to live data, we can, predict the system operation, and also understand the energy trend, and also understand the power assets operational trend, and which is quite very important for a business model like the power purchase agreement. The power purchase agreement require a remote monitoring device that gives live data, such that you can ensure your system is working optimally and the energy is being consumed optimally through the end users. In terms of lesson learned and broader business strategy, lesson learned, it's very important to have a strong service level agreement with the OEM for the sake of maintenance, for the sake of spare part replacements, for the sake of ensuring the entire asset is operating as planned. And of course, it's very important to have a unified health institutional platform to ensure that the general health facilities within the country are under the same umbrella, and they can share news and possibilities of also them reducing their energy cost, and of course making the operation more sustainable. In terms of business strategy, of course, there are several opportunities out there for project developers to develop and implement a more sustainable power system for health facility, so as to ensure their operations are sustainable and cleaner for future sake. Thank you for your time, everyone. And these are just pictures of the projects. The panels are ground mounted, and the panels are literally mounted in a location that's about 5 meters away from the powerhouse. And this is just a drone picture of the site. All the buildings, literally the buildings where the operation are being executed. Could you go to the next slide, please? Yeah, and this is the powerhouse, which is just 5 meters away from the solar ground-mounted system. It's an interesting project, and so far we've hardly had any technical issue. Yeah, so everyone, thank you for your time.
Thanks, Deji. Awesome. So now we're going to move over to Benin and the projects from ARESS, and Léonide is going to speak on those 2 projects. So Léonide, over to you.
Okay, thank you very much, Kathryn, and all of us. So my name is Léonide Michael. I'm from Benin, and I'm managing ARESS. ARESS, as described, which is like a brown Pan-African company, clean tech, established since 2012. We are present in a lot of countries, Benin, Togo, Senegal, Burkina Faso, and Niger. And we are experiencing, as we used to say, local expertise, matching with international standards. We are a team around 100 persons, a third are women, taking into account all the different sectors of business that we address. To this, ARESS succeeded to deploy more than 5 megawatts in our country, impacting more than 500,000 of people. ARESS now is a subsidiary of a group based in France, who is called My Joule Box. So for this project, we can move to the next slide. In the context of Benin, what is quite interesting is that more than 50% of the healthcare services are provided by private. And in this context, more than 2/3 of them are in areas where access to energy is very scarce. This is for this assumption that we submit to the pilot project by Shell and Odyssey, where we selected 2 sites of the north of the country. I'm presently in the north of the fields for other projects. What we really want to experience in this project is the unique context of innovation and the modelization, because according to the regulation, we cannot, as I see in Nigeria, operate in terms of tariff because it's not a concession. So we should be able to provide like very intelligent system and performance to address services dedicated to different core of business. And that's why for this project, in area where access is below 10%, we address a project with 50% coming from grants for the CAPEX, 20% for engineering, designing, and human resource from ARESS, and the third of the payment missing will be the fee-for-service period payback, by the beneficiaries for a 10 years period. So this is monthly payment for 10 years, so around 120 period. What we learn mainly from this project is that grant and subsidiary are necessary for this experience, because we cannot address the full capex and the opex only as running as a regular business. Also, the one big experience for this project is the online and real data monitoring enable to follow up, to assist, and to support the after sales. But at the end, what we learned since the commissioning is that it's necessary to get teams on the field, because, for example, for any technical challenge, sometimes we need to address them physically. You cannot interact 100% remotely. And definitively, this experience has been a very big success for us in the country. If I can wrap it. This experience was definitively a very high success, because the center are running 24 hours, 7 days. To date, we have consumed more than less than 40 megawatt hours, and yearly today we are recording around 10K USD in terms of energy bills saved. So for the last slide, please. Okay. So definitively, yes, this experience, it's a very true spirit of ARESS motto, because we ran pilot to prove the capacity to scale and the viability, and this is totally what we address. And this is a very big opportunity from Shell and Odyssey and the other parties. And to date, now we are addressing more center, taking into account the potential in the areas. Now we are discussing with the different church, because the Catholic has in portfolio a lot of schools, health, and church also. And the potential that yearly we can address in Benin is around 3 megawatts yearly. So unfortunately, I don't take time to put the images. We can come after on our support. And I thank you for this attention.
Thank you. All right, so next I'm going to pass it over to Kyle at Nuru to speak about their projects in Tadu and Faraje.
Hi, everyone. I'm Kyle Hamilton, Senior Manager of Strategy and Partnerships at Nuru, and great to be with you on this call. So Nuru, we aim to provide world-class power to 10 million Congolese people by December 2030 through financing, constructing, and operating utility-scale solar hybrid metro grids in the Democratic Republic of the Congo. We currently have 4 assets operational, totaling 1.69 megawatts across those assets, serving 3,000 connections and probably about 22,000 direct end users. And on that infrastructure, we also are operating over 450 streetlights across those 4 assets, serving tens of thousands more. Building on this experience, we recently secured equity and debt financing to scale and to add an additional 13.7 megawatts. We're currently underway on those projects, and we're hoping to commission them during the next 24 months and serving an additional 30,000 direct customers, and then probably an additional total of 225,000 direct end users from those customers. And through these new projects, we're also planning to serve new healthcare facilities, which is exciting as well, building on the experience that we had with Shell Foundation and Odyssey on this project. So a little bit of background about this project. This project was a very challenging project. It was located in a very remote northeastern part of DR Congo near Garamba National Park in 2 communities, Tadu and Faraja. So there are 2 different mini grids totaling about 338 kilowatt peak. And we were serving over 400 customers across those those 2 mini grids, including 4 or 5 healthcare facilities in serving those communities, especially the communities in and around Garamba National Park. Some of the key contractual details: we have a 25-year concession approved by the government, so we're able to generate and operate for 25 years through these mini grids serving these healthcare facilities and our other customers as well. The financing model that we were working with Shell and Odyssey were results-based financing, so getting paid for results delivered with some of the money paid up front, and then some paid on delivering of key results. And then also Peace Renewable Energy Credits, which are traditional renewable energy credits where 1 megawatt hour of generation equals 1 credit. And then you sell the credits or the megawatt hours to a buyer. In this case, we were able to pre-sell the first 5 years of renewable energy generation to Google. And we were able to use that financing to support the project as well. And then in addition to those 2 core pieces of financing, we had in-kind contributions, we had guarantees, we had project debt. And I would also like to give a shout out to Powergen, who also helped us on this project. So we worked with Powergen as an engineering, procurement, and construction firm on this project. So thank you for your help on that. I think one of the key challenges that we faced was trying to work with the government. And we have a great relationship with the government, but at the time they had a new regulator that was emerging, and so new processes were developing, and you have different approval processes with different layers of the government, from the provincial to the regulator to different ministries, and as a result, we went the first year without being able to generate revenue on the project while we were waiting for the different government processes to be finalized. We're happy to say that through our partnership with the government on this project and other projects, we've been able to work with them to really develop those processes and make them much more transparent and standardized moving forward. And we've been able to move forward with other projects a lot more easily after this one. But that was a significant challenge that we faced during this project. I think in terms of the impact on the healthcare facilities, we were so all these healthcare facilities did have some type of energy access before. It was just very irregular or inconsistent. Some of them had it through a diesel genset, some had it through solar home systems, but it was not able to meet their existing needs and demand and to provide the energy services that they needed in order to serve their patients and clients accordingly. So really, we were able to really improve the reliability, the quality of the energy they're receiving to reduce their overall costs. One thing I would like to highlight too is just the voltage quality. We were able to improve their voltage quality, and we were able to work with some researchers at UC Berkeley to measure and assess the voltage quality after Nuru, and we were able to really see that the voltage was really stable and perfect to operating medical equipment. And so shout out to Samuel Miles, who helped us with that research. And we were able to improve their customer service. So no, they weren't having to deal with all the logistics of procuring their own diesel or maintaining their solar home system. Now we're providing and doing all of that energy service work for them. So that reduced some of their workload and burden. And then we're also able to provide basic internal wiring services. So we used part of the grant we got from Shell to improve their internal wiring, to improve how their electricity would be used at the sites. And then another critical component, of course, is lighting. When you have access to 24/7 electricity like they do now through Nuru, they had improved lighting both at their sites, but then also through our public street lights, we had lighting as well to light the path to anyone that would need to get to the facility after the sun goes down. So the key role of this pilot project was providing, like I said, results-based financing and PREC financing to improve energy access for the healthcare facilities and to de-risk de-risks the overall investment. So working in a very remote site, these projects needed and really benefited from these types of funding. And I will just say one other thing: we were able to win the mini grid project of the year from the Africa Solar Industry Association for this project. And so we had many different partners who made this project successful, including Shell and Odyssey, and we were really grateful for their support. Lessons learned, and so I think one is, again, that regulatory process, that was really a really key lesson for us, and we really worked carefully with the government. And like I said, things are much stronger now and more standardized. I think the importance of results-based financing to de-risk projects, especially in more remote rural locations, I think is going to need to continue to play a role. Often people ask, okay, how are these projects going to be sustainable in the long run? And I do think they're going to continue to need some results-based financing to de-risk projects and make them catalytic. And if you look at oil and gas or fossil fuels more broadly around the world, according to the IMF in the past year, they received $7 trillion globally in incentives or subsidies. So I think, doing large-scale infrastructure or rural-based projects, there's going to be a continued need, I think, for these results-based financing and PRECs to support these projects. And then finally, I've already touched on this a little bit, but there's a difference between energy access and energy quality. And we've seen at other healthcare facilities that we've connected to where we were able to do a before and after study on their reliability and voltage quality. And the voltage quality before was so bad that had sensitive medical equipment been connected to their system, it could have damaged the equipment. And now after Nuru, they have much better voltage quality. So again, energy access obviously continues to be really important, but so does that reliability and quality to ensure the quality service to patients. Next slide. Yes, so why did we apply for this pilot? Well, really, first and foremost, to improve lives in critical basic human services like healthcare in and around Garamba National Park. The healthcare services that we're powering are important, providing important services regionally, not just in the specific communities, but people would travel many kilometers away to get the healthcare services from the health facilities that we're powering. We already talked about the financial and some of the key impacts there. I think one of the key things I'd like to also say that working with Odyssey to share the metering data remotely through their platform and being able to do an API integration between our metering data and Odyssey so that Shell Foundation could see and verify remotely and monitor the data was really made everything really efficient and lowered overall program costs for everyone. And I just want to thank Odyssey for that work and just highlight the important role of being able to do remote verification and reducing program costs, enabling more money to go directly to results-based financing and other types of financing for these types of projects. I'm happy to answer any other questions during the Q&A. Thank you.
Awesome. Thanks, Kyle. Next, I'm going to hand it over to Francis from Infra, formerly Stella Futura, to speak about their 2 health facilities in Ghana. So over to you, Francis.
Okay, thank you, Kathryn. So I'm Francis Asante, the CEO for Infra Futura. Infra Futura, formerly Stella Futura, focuses on CNI projects in sub-Saharan Africa. To date, we've implemented about 4 megawatts of solar PV projects, and we have a specific focus on healthcare electrification, where we've implemented projects from Somalia and then also mainly in Ghana. In Sweden, we have a sister company, Stella Futura, that focuses mainly on batteries, and to date we've installed about 48 megawatt hours of batteries across Sweden. So our project to talk about today, is based on the hospitals that we have implemented in remote areas of Ghana under a similar program that was mentioned earlier, through a partnership with the Christian Health Association of Ghana, which is facilities that have been built under the Christian religion, and they were mainly focused in the past or situated in remote areas that serve about 60% of our population. And through that, we also provided mobility service as well. And so we did donate electric bicycles that are equipped with chiller boxes that should help in public health activities as well within the region. So why we applied for the pilot, the main reason was to unlock the project, especially both on the feasibility end, which normally is a hurdle even before you get into the implementation aspect of it. Getting around the technical assessments, the size and the engineering aspect of it, and then mainly also to reduce the capex for the project, which will serve as a pilot and then also enable scale up through over 390 facilities that are currently in Ghana. The financing mechanism that was used, we also used an innovative blend of equity, grants, and carbon finance, in this case, direct distributed renewable energy certificates. And I will say that the grant component formed close to about 40% or 41% of the mix. And then came the equity of over 44%, and carbon financing around the ranges of 15%. And so when you look at it from a waterfall kind of basis, starting from a tariff of about 23 cents and basically reducing it by the contribution from each of these financing activities, we were able to provide about 11 cents per kilowatt hour to these hospitals, and also in local currency, which was a very big, I think, deal breaker, I would say, for the facilities, because at that time Ghana was going through a very, very deep currency depreciation, right? So we started with a dollar-based contract and eventually turned around into a local currency, and I think that was the best for the hospital facilities. The impact of electrification of the health facilities. So what we do currently is we do provide sort of quarterly reviews with each of the facilities, and to date, since they were implemented in the first quarter of last year, they've seen about 56% savings to the hospital facilities. And these savings have been reinvested into staff and modern equipment. Some have actually put in new incubators and also lab equipment. And then the third point, there is a transparent understanding of energy consumption. So these facilities are grid-tied, and also because of the low quality of the grid, and in some cases, even though there's the grid, is as inefficient as it can be available only 40 to 50% of the time. They buy the diesel generators, and the grid meters are not read on time. So there is always the confusion about their grid bills, right? Because if it's not read today, it is estimated, right? What the grid company will do is estimate it for billing purposes. But after we install the solar PV with the monitoring systems, both our monitoring system and then also the monitoring system that Shell Foundation also has installed, it gives the hospitals the visibility of all sources of energy, solar, grid, and then the diesel generators, and they're able to use that, especially the grid side, to basically cross-check what they are being billed by the grid company. They're able to understand exactly where their cost drivers of energy is coming from. And then most importantly, for our billing purposes with them, it makes it easy and transparent, right? We've trained them on how to use a monitoring system in addition to training them on the whole solar infrastructure. So it becomes an easy conversation. On the bikes that were provided, it's previously for public health services, which is the hospital staff go out in the remote areas to remote villages that are not accessible by vehicles, or that the citizens are not able to come to the hospitals. They use fossil fuel bikes, and so these bikes now are able to go far without fueling or very, very low maintenance. And then also the chiller boxes that were provided helps them with their cold chain vaccine delivery, as well as any medications that have to be delivered under cold chain purposes. What has been the impact of participation in the pilot? I would say that access to the grant funding for the project capex was very, very key. I mean, without that, we wouldn't have taken off. In fact, we did spend about 2 years prior to accessing the grant, and those 2 years were spent on speaking to our traditional CNI renewables financiers that we all know do not have the appetite for such smaller projects. And in addition to that, there is all that risk factors that are attached to them, which the facilities do not qualify for. And then thirdly, because of the capacity, it doesn't have the scale, so the monthly repayments are naturally higher than either the grid price or than what the hospitals can afford. So this really helped in that regard. Access to financing partners with shared interest. So through Shell Foundation, we were introduced to Power Trust, and so monetizing the megawatt hours produced helped us also mitigate the risks of the project that are attributed to currency, right? So we're able to, it helped us go from US dollar-based contracts to CD-based contracts. And then we also, I spoke about Odyssey's remote monitoring system as well. Lessons learned. I will say that partnerships. Well, there's a local training that needs to, is very, very critical. I think when we talk about one of the things that helped in navigating through a structured, these 4 hospitals are Catholic hospitals that we've implemented to date, and navigating through the very structured Catholic hierarchy, because they really want the local facilities who would benefit from the solar energy to be the ones making the decisions, and that required training of everyone on solar PV, to go across some of the misconceptions of it. I'll also mention partnerships, right, which were very key. So with Shell, with Cake that provided the bikes, and then with Power Trust to make that happen. That was very key. The currency risk, I've mentioned that, but we learned it as we started the program. And then we started with US dollar-based contracts, which is a high purchase agreement for 15 years, inclusive of operations and maintenance. And it took us close to about 12 months and beyond when the currency depreciations really started to hit. And that was something that the hospitals did not really want to get into, which when the currency situation came up, we did realize indeed it is a reality, right? And so that these contracts need to be structured in local currency just as much as possible. And that is where what my colleagues had mentioned earlier, the grants become very, very key in helping to reduce the burden on or de-risk it, so to speak. Mobilizing private investment still remains a challenge. So for Infra Futura, we are looking to scale up, and so with about 390 hospitals or healthcare facilities that are available, the challenge is having that mix of grants versus equity or debt, and then also with the DREX or traditional carbon financing, right? We know that the scale at which Shell participated in this program may not be accessible, right? And so how do you get balance, access to cheaper finance and backed by either DREX or carbon finance and some grants to still make healthcare electrification possible and affordable to the user. So that's an area that we are still navigating through, I'll say. Okay.
All right, thanks, Francis.
Good.
I think maybe just in the interest of time, we'll leave this slide with more detailed information about the project for people who, after the presentation, want to take a look. But over to Elena to kind of bring all of these pieces together and talk about ECA's work on the final report.
Thank you, Kathryn. My name is Elena Adamopoulou, and I'm a technical director at ECA. It was great to hear developers sharing their own insights about what it takes to electrify a health facility, what the challenges are. And for me, one of the key advantages of this pilot program was its bottom-up design and approach that supported and allowed for learning from the experience of developers. These are the people that are at the front line of healthcare electrification, and it's really important to make their voices louder. And I think it becomes clear from what we heard today that electrifying health facilities is not an easy job. There are myriads of challenges and obstacles that we need to overcome in order for these health facilities to get electrified. But there is a famous quote from Nelson Mandela, which I think is very relevant in this context. It always seems impossible until it's done. And this pilot program, other programs that electrified health facilities have done it. The important thing to remember, something which I think we often overlook, is that we have the technology, we have the know-how to build reliable power systems to connect even the most remote health clinic on Earth. Something which was a concern maybe a few decades ago is no longer an obstacle. Companies like Powergen and Nuru that are with us today and others, they have been doing this for many years and they have well-tested models. The limiting factor, what holds us back from bringing down the number of electrified facilities to zero, is mostly financing. We need the right type of financing and funding for each electrification project, and we need it at the right time. Now, having listened to the individual experiences of the participating developers, I want to zoom out a little bit and give you the bigger picture and share with you some of the key findings from the study. So I will focus on three things. One, the general impacts of these electrification projects, some general key insights that we have highlighted, and we will then conclude with some recommendations. Next slide, please. Right, so when examining an electrification program that targets health facilities, I think it's important we move away from just reporting connections to looking at the bigger picture and understanding how that project affects the quality of services at the facility level. We often forget that electrification is not the end goal. It's an enabler for something bigger that goes way beyond just ensuring that health facilities have an electricity connection. And what was great about this project is the very thorough data collection that took place before and after the electrification projects that really allowed us to understand how electrification can improve the quality of healthcare provision. So generally, we observed a significant improvement in all the metrics that we examined compared to the baseline, so before the implementation of the electrification projects. So more specifically, the availability of electricity improved significantly. And while power outages are generally disrupting for healthcare facilities in particular, power cuts can be life-threatening. So ensuring that power interruptions are minimized during operating hours is really important. In the case of the pilot program, 43% of the facilities reported fewer power cuts following the pilot. Also, for more than half of the facilities, the systems installed through the pilot cover their entire energy needs. And this is really important. We need to make sure that the electricity that is available to the facilities is enough to allow them to perform all the services they want. Operational efficiency also increased following the pilot program. Half of the facilities were able to automate some tasks that were previously done manually, like lab results, financing reports, etc. Reliable electricity supply also increased patient attendance. They also managed to buy new equipment as a result of higher reliability of supply. Some of them bought autoclaves, others bought cold chain equipment, lab testing appliances. And this really allowed some of the health facilities to increase the range of services they offer to patients. Patients were also very happy with the new electricity supply. Almost all patients rated the quality of supply as at least good. And very importantly, waiting times for patients were reduced significantly. This ensures timely access to medical care, which helps prevent medical conditions becoming worse. Other broader positive impacts from the pilot program included the introduction of e-bikes for vaccine dissemination, as we've just heard from Infra Futura. Also, some developers leveraged the opportunity to incorporate gender mainstreaming considerations into their service and have targeted almost a third of their team of installers to be female. Next slide, please. So now I want to focus on three main insights that we have highlighted in our study following the pilot program. The first one is sustainability. This is the most fundamental aspect that one needs to consider when designing an electrification program for healthcare facilities. It is not just about connecting these facilities to power, it's about ensuring that these connections are durable, reliable, and truly beneficial in the long run. Unfortunately, a common trend that we have observed in the many programs focus just on these initial connections without considering the future. Many of the power solutions deployed don't even reach their natural end of life. And this is a big problem. Not only because it's a massive waste of money, but at the end of the day, the same health clinics that were previously electrified remain in the dark. So it's vital that the solar systems installed today are still operational and effective 5 or 10 years down the line. And this is where business models or delivery models come in, and why it's important to ensure that the aspects of maintenance is addressed. That whatever the chosen delivery model is, it takes into consideration that these facilities that are electrified are most likely public health facilities. These facilities run with very small budget allocation from either the local authorities or the central government. And this allocation needs to cover pretty much everything from salaries to operational expenses. And they simply don't have enough means to replace a component if it breaks down. In an ideal world, yes, we want these facilities to be more independent, to have sufficient budget to pay for electricity and for maintenance. But we need to understand that this is currently not the case. But we do see that stakeholders are heading towards that direction. They're putting more emphasis in long-term sustainability. So what we have observed is that there is an effort to move towards an energy as a service model, which can take various forms. It can be leasing, it can be a flat fee the consumers pay monthly. But the main idea here is that consumers, in this case, health clinics, pay for the kilowatt hours they use and not the assets as such. That means at the end of the day, it's the developer's job to make sure that these systems are running properly. But we need to remember that the energy as a service model is not a panacea to the sustainability problem. We need to protect the developers from the risks that they face when they sign a contract with a facility or the ministry. We need to minimize the risks for the investors, and we need to ensure that the regulations are there to support the implementations of such delivery models. The second main insight I want to talk about is scalability. Pilots are great to get a few projects off the ground very quickly, and they provide the data and the learnings that we need in order to implement healthcare electrification projects, but they cannot solve the problem. If we want to provide reliable electricity supply to those 100,000 facilities, we need scale. So how do we go from 11 health facilities to 100,000? Scalability is a bit of a complex issue, and that's primarily because of the heavy reliance on grants. Grant funding is great, and many of these electrification projects wouldn't exist without grants. They're simply not enough to reach the scale that we want to achieve. The key here, I think, is blended financing. We need both public funding and private capital. So it's not a question of either or, but it's important to leverage the available grant funding to mobilize private capital and de-risk investments. Development finance institutions can play a major role here. Apart from grants, they can provide guarantees against payment risks, which is particularly an issue for public health facilities. It is also important to use public funding to reduce the currency risks that developers are facing, because a lot of the health facilities that need to get electrified are located in countries where the currencies fluctuate a lot. And we've heard that from the developers that spoke earlier. So if they were to meet their payment obligations in a hard currency, but the revenue comes in the local currency, that over a period of 3 months has lost 20% of its value, then how do we expect these developers to remain financially viable? Another critical factor for scalability is navigating the regulatory landscape. We heard Kyle from Nuru earlier talking about the challenges they faced negotiating with the DRC government, how the delay in obtaining permissions affected their financial viability. The enabling environment needs to support the fast deployment of power solutions if we want to achieve scale. The third key insight here is technical design. We need to be smart about how we design the energy systems. The size of a system is a key parameter of how much this project is going to cost. So oversizing the system can lead to unnecessary upfront expenses. So it's really important to try and accurately determine what the energy needs of the facilities are. Of course, we need to take into account potential expansions in the services that health facilities offer and the type of appliances they use. And to be honest, this is what we want, right? We do want them to modernize their equipment and offer better quality services to their patients. So how do we balance cost efficiency with meeting the energy needs of the facilities? The key factor here is modularity in the system design. Modular systems consist of building blocks that can be scaled up incrementally if and when the facility's energy demand grows. Energy efficiency is also important in this context. By choosing energy efficient appliances, we can significantly reduce the overall energy demand and meet the energy needs of the facilities without requiring any major upgrades. And from the experience of the pilot, several health facilities have done that. One of them replaced its old inefficient funds with energy efficiency ones in an effort to bring down the energy consumption. Next slide, please. Right, so there is no one-size-fits-all solution. We keep saying that, but it's true, and we need to really understand this. And this study is a good example that there are different paths to success. We heard from the developers that each adopted a different financing model. Development partners should really provide the flexibility. They should allow the developers to choose the financing model that works best for them in the environment they operate in. However, it's important to ensure that two things are in place. The first one is that developers are not cherry picking. If we really want to reach 100% electrification, then even the less viable sites need to be electrified. And the second thing is that there needs to be a long-term framework in place for operation and maintenance. We need to ensure that the health facilities remain electrified in the long run. We need to ensure that if a battery stops working, there is a framework in place to replace the battery and make sure that the system is up and running. We also need catalytic funding. As we mentioned earlier, grants are great, but they're simply not enough. Private lenders perceive these investments as too risky. So we need to really be smart about how we use funding, and we need to look at alternative sources of funding as well, which is what many of the developers of these pilots have done. We've heard earlier from Infra Futura mentioning that they relied on directs to finance part of their project. Climate funding, climate finance, including renewable energy credits, can offer new streams of revenue for developers. While at the moment is not substantial, it can cover a portion of the CapEx and OpEx. And I think it's important to remember that whenever a solar system is deployed to electrify a health facility, most likely that means less diesel fuel being burned and less carbon emitted to the environment. And given how big the climate sector is at the moment, I think it's important that we start exploring ways how to make climate funding flow to the healthcare electrification sector. Holistic approach. When looking at electrifying health facilities, it's important that we go beyond just electricity supply. If we were to fulfill our mission of supporting health facilities to provide higher quality services, we need to look at ways to provide them with access to medical appliances. We also need to make sure that they have adequate access to other types of infrastructure, such as water. It's important to remember that access to electricity won't make a difference unless all these other factors are in place as well. Lastly, we need more data. We need good quality data. Trying to design a healthcare electrification program without data is like trying to drive at night without any lights. We need data to prioritize the health facilities that need to be electrified. We need data to understand the energy needs of the facilities. We need the data to then decide how to disperse RBFs and other types of financing support. We also need data to track O&M. Remote monitoring technology is great in that respect, as it can support a lot of these functions. So it should definitely be a key component of any healthcare electrification program. And I'm sure Odyssey will be very happy with this concluding remark. Thank you very much.
Thanks, Elena. That was great. I know we are a few minutes over our scheduled time today, but we do have some questions that have come up in the chat box that we'd love to try to answer. Maybe we could spend 2 to 3 more minutes together and go through those. I know some of them have already been answered directly in the chat box by folks like Kyle and Deji. One question that seems consistent, I think we got it a few times here in the chat box, is expanding on potential other revenue streams for the health facilities. So thinking about other income generating activities that maybe a more reliable energy system is paving the way for. So I don't know if any of the grantees want to speak about their experiences there. Maybe Francis with the e-bike component. I don't know if that was a revenue generating stream, but definitely a cool example of a side activity that was able to be implemented through the electrification of the health facilities.
Yes, that's correct. It was not a revenue generating activity for us. We basically saw that as kind of one of the enabling, and because this was also COVID and post-COVID, and once as we were doing the assessment, we found that they actually went on the fossil fuel bikes and then would purchase. Some of them had bags, plastic bags with ice blocks in them to preserve, medication. So that's one of the elements of partnerships that we reached out to Cake Bikes, and they donated 3 bikes for this purpose to help solve another problem.
Got it. Cool. Thanks for diving into that a little bit more. One of the other kind of categories of questions is around digital technologies for operation and maintenance. And I know we've spoken a lot about Odyssey's remote monitoring and control solutions there. But one question specifically was on maybe how local teams interact with the Odyssey platform. So Deji, I know Powergen's Ijebu Eye Clinic is a great example of this. Would you mind maybe spending 30 seconds talking about how the local team uses the Odyssey platform?
Yes, I can say something on that. So it's quite straightforward and seamless. The health facility has gotten access to the Odyssey platform that gives them some sort of insight on their consumption, and of course, in terms of energy generation. And in terms of the local technician, I'm assuming you are talking about the operation and maintenance technician, right? If that's the case, yes, the local technician also uses the platform to, have an idea of what the energy trend is, and also understand what the energy consumption and generation is, and of course, understand how the faults are being generated within the system. So in the case, if there's a fault in the system, the local technician would then use that as a guide to then visit the site, remediate the issue, and have the system back in operation. So it wasn't a big deal, it's easy to understand, it's easy to comprehend, it's easy to download data and also analyze the data for optimal operation of the entire power assets. So I mean, it's just literally seamless, really. The Odyssey platform gives so much information to understand the operational trend of the assets, and that would also aid operational maintenance of the asset, essentially.
Great, thanks. And our team is happy to speak more about the remote monitoring and control side. If there is additional interest, you can definitely reach out. Kind of switching gears, maybe the last question, I know we're quite a bit over our scheduled time together, would be how grantees actually went about selecting their sites. So in the call for proposals that I mentioned, grantees submitted an application with specific site details and reasons why those sites should be selected and included in the pilot. But site selection is definitely something that's very important. And candidly, for this pilot, several grantees needed to switch which sites they were focused on electrifying due to challenges throughout. So maybe Kyle, I know Nuru has a really thorough approach to selecting sites. So maybe if you could speak to that, like how you go about selecting sites.
Yeah, thank you, Kathryn. So this particular project, the Garamba project, was a bit of a special project for us because we were contacted by Garamba National Park and their partners to deploy 2 mini grids in the communities adjacent to the park, and in part to support basic human services and new job opportunities and new businesses in those communities because of the complex relationship between the community and the national park. So that was kind of a unique project for us. We would call it a special project, being more remote, one that would require a bit more grant support and different types of grant support and in-kind contributions and partnerships to make happen. Our typical site selection process, however, is to look at communities with existing C&I, so commercial and industrial off-takers, to do some data logging, to assess their current energy needs and future energy needs, and then also to look at how the densities of the retail customers, so households, small, medium enterprises, and maybe smaller social institutions might factor into that. For the Garamba project itself, in certain cases, some of the healthcare facilities they were considered one of the larger consumers of electricity in the community, and then in other cases they were kind of more average among smaller social institutions. And so, for us, it's really looking at we're looking to displace dependence on diesel in particular. So where there is high energy demand and proven energy demand, where we can go in and displace diesel, but then also where there's opportunity by using anchor clients to provide energy access at scale to a wider population, now to provide energy access to many new customers. And often in our markets, we see, with the appropriate densities, we do see a lot of growth in new businesses that emerge because of the stable energy infrastructure that we're deploying. We're seeing a lot of new businesses and customers emerge who are first-time users, or maybe new entrepreneurs who are expanding their operations. So I hope that gives a little bit of an overview on that point.
Mm-hmm. Yeah, thanks. That's great. I love the point about health facilities being a potential anchor load for mini grids specifically. Cool. So I think that's pretty much all we have time for today. I know a lot of answers have been, again, typed out and chatted in our Q&A. And we will be saving these questions as well and taking a look and potentially sending answers out after the session along with the recording. So thank you again, everyone, for all of your time today, and especially to the grantees for sharing more about your experiences. It's been a really wonderful and informative time working together on this pilot. So thanks again, everyone. And with that, I'm going to stop sharing my screen and I think end the webinar for today. But our team is happy to relay questions to some of the grantees if there are other outstanding ideas that come up after today. Thanks again.
Thank you.
Yeah, thank you. Bye.
Thank you,
Thanks.
Kathryn.
Bye to all. Thanks. Bye-bye.